Hi, I'm your host, Amy Freena. For over 30 years, CareCredit has been enabling people just like you to get the care, procedure, or surgery they want or need when they want it. Behind the thousands of amazing testimonials we receive from our cardholders are the dedicated providers and healthcare workers who make these stories possible. In this series, we are giving you exclusive access to these well-respected and renowned care experts who are all part of our CareCredit network and asking them to share the information and answers you need to make informed decisions about your health, wellness, and personal care. Joining us is Dr. Eugene Nowak, a popular board-certified dermatologist who practices in Chula Vista, California. Dr. Nowak received his medical training at Midwestern University and completed his residency at the POH Medical Center through Michigan State University, acting as chief resident. He has spoken internationally and performs as preceptor to many physicians, training them in dermatologic and cosmetic aesthetic procedures. Hey, I'm Amy, and we are joining you live from the studio today with Dr. Nowak.
Yeah, exciting stuff. Thank you for having me.
Absolutely. Thanks for being here. So we're going to just kind of warm you up a little bit, and we've got some questions for you, okay? So first one, why don't you tell us a little bit about your journey to plastic surgery?
Yeah. Well, it's really an amazing time. And so I trained when really aesthetics was just really starting and becoming, it was available to have lasers in your office. Before that, a laser was in a research setting or a hospital. And so I've really watched this industry bloom right before my eyes.
Right.
Yeah, so things that we only dreamed about years ago, now we have those options today. So we have things that are minimally invasive, minimal downtime, recovery time. And so really started, I'm a dermatologist by training. Grew up loving lasers and technology and trained in an amazing program where I was able to do a lot of aesthetic treatments during my residency program. And like I said, these procedures are just becoming available to where you can do them in your office. And that's where my focus is. Minimal downtime, minimal recovery time.
All right. Well, we'll get more to that later. So before I get into asking you some questions, can you tell us a little bit about your credentials and your background?
I'm a board-certified dermatologist.
Okay.
I went to medical school in Chicago, went back to Michigan, and did a couple years of internal medicine, 3 years of dermatology, practiced a couple years, and then opted to get rid of winters. And
I don't blame you.
Came to California. Yeah, so Michigan's a great place to be from, but the winters are so much nicer here. So. Took over a practice from a doctor that was retiring and took it from a small retiring practice into a thriving, growing, wonderful practice.
All right. You've mentioned how technology is just constantly moving forward. Is this a trend, and where do you kind of see the industry going?
Well, it's definitely a trend, and it just continues to head in that direction. So more and more patients come in and say, what can I do without a surgery, without scarring, without a big downtime or recovery time? Whether it's they can't take time from the kids, they can't take time from work. So more and more you hear that. So as we said, technology's changed. We talked a little bit about the thermal lipo procedure. So when someone's looking for a more dramatic result, they need to see it quickly, and I want it as dramatic as possible, well, they come and see me.
Okay.
So if someone says, I have areas that I can't get them where I want them, but I can't have the downtime, we can do things like cool sculpting. I can do lasers to shape and contour those areas. And we can do it without a downtime or recovery time. So now we have ways to treat muscles. Years ago, patients would come in, we'd say, boy, your muscles aren't good. Surgery was the only direction for them. But now we have technology, M-Sculpt, and there's a whole variety of other technologies that are coming as a ways to build muscles, make them stronger, make them tighter. We have a patient, she's doing fitness competitions, and she says her workout has between doubled and tripled just with having that done.
Wow.
We had a patient come in, she was in her 60s, and I said, what are you looking for? And she's like, I want to do planks. She goes, I can't get above 30 seconds. I just don't have a stronger core. So she did the treatments, comes to the follow-up. I said, how are those planks doing? She's like, 4 minutes.
Wow.
She's like, the only thing I've done is this machine, and my core is totally stronger. So we talked to her about maintenance, and she says, if I lose time on my plank, I'll come back in. But for right now, I'm happy.
So do you see, the technology continuing to increase? And my gosh, her plank time could be 10 minutes in the future for all we know.
So if she wanted to get to 10 minutes, I think she could get there if she wanted to. So absolutely, it's going to just continue to evolve. Like I said, whether there's going to be continued improvements with laser technology, like I said, modalities like addressing the muscles, things that we didn't have before, it's only going to continue to happen.
What's microneedling? That sounds rather painful.
Well, really, it's not. And I
Okay.
know a lot of people, I think I know what you're talking about. There was a video or a TV show out there where someone's oohing and ahhing the whole way through. And when I brought it to my office, one of my staff sends me the video and says, "Are we really going to do this to people?" And I was like, that's not how it's done. So microneedling is really doing a lot of what we're doing with the laser.
Okay.
So it's using little microneedles to make openings in the skin to create a controlled healing response. Now, we do it with topical numbing. So the patients are very comfortable. I have patients say, I feel like I want to take a nap. I'm feeling relaxed because it just makes like a little vibration there. So we're just going over the surface of the skin. It helps with pigmentation. It helps with the texture of the skin. It can help with lines and wrinkles. It helps with acne scars. We can do it by itself is kind of level 1. Level 2, we do it with PRP, platelet-rich plasma. That's where we draw the vial of blood.
Okay.
We get rid of the red blood cells. So if
Okay.
you've seen a video with someone with that they're red all over, that's not how it's done. We're using the straw-colored liquid, kind of like if you get a scrape or a scratch, that little yellow liquid, that's PRP. That's what your body creates to heal it. So we're taking that, we're introducing that back into the skin to stimulate more collagen production to create a healing. So we can do it topically. And if you have a deep area of concern, someone has some deep scars, we'll actually inject some into that scarred area to stimulate even more healing response for them. We're getting really close to a laser level result with a series of those. So if someone can't have the downtime of a laser, wow, we can do a lot just with that little microneedling treatment.
That's fascinating, and thank you. It has such a kind of a stigma to
It
the
has
name.
a stigma
So-
to it. And there, like I said, there's a video out there that's not really how it's done. Yeah.
So I've heard of the vampire facial. Is that what this is?
So, yeah, this would actually be a vampire facial, like I
Okay.
said, but we're actually drawing the vial of blood. We're getting rid of the red blood cells. When it was first done, they would save a couple drops of blood to put it on the patients to make them look that way. But it's really the PRP is the magic of it, the platelet-rich plasma. And then, like I said, using the little micro pen there. So for us, the vampire facial, they're going to be a little bit red, 24 to 48 hours, unless they have like some deep scars, then they'll have a couple extra days. They might have a little dryness, a little flaking, or a little peeling, but really not a lot of downtime or recovery time.
What about the pain level?
Like I said, it's really comfortable. Yeah. Little topical numbing, that's all that's needed.
Wow. Doctor, you're a great speaker, and you have given me and everyone at home so much knowledge. Do you speak professionally? Have you written any books? Surely you have some background.
Well, there's a lot of things that we do. So, the local TV news, we're on regular with them.
Okay.
I really love technology, so I'm always out there researching, trying to find what's best for the patients. And so if we have new technology, the news will either come to us or we'll go to them. I did write a book. It was designed for patients. My goal was to write a cookbook, but they're like, nope, you have to write a book.
That's retirement.
So I had to write a book. Well, I wanted to write a book because there's so much out there. Years ago, there was only option A or option B. Now there's so many options there, and that's probably the biggest challenge for patients is to find out what is the best option for them. Finding an office that has multiple options.
Right.
Because if the office only has one option, that's option A, B, and C is that one option.
Right.
But if you have an office that has different treatments available, different technologies, you can customize and combine those treatments to get the best result.
So what's the title of the book?
You only better.
Say it again.
You only better.
You only
That's
better.
that's our philosophy.
I love that.
It's going to be you only better. We want you to look like you. We
Right.
just want you to look like yourself.
The best you
Younger,
can be.
The best you can be.
All right.
Yeah. So
Wonderful.
And I do some speaking also I used to do a lot of speaking years ago, and then as the kids got older, I did less of that, but I've been invited to speak more around the country.
All right. Well, thank you so much for your time and all of your insight. We
Thank
definitely
you.
appreciate it. If you are considering this procedure, we hope we've provided the information you need to decide if you want to take the next step and schedule a consultation. Remember, CareCredit is a leading national healthcare credit card that can enable you to get many of the surgeries, procedures, and treatments you want now and pay over time with everyday promotional financing on purchases of $200 or more. CareCredit can also be used to pay for copays, coinsurance, deductibles, and your health and wellness needs. CareCredit is accepted at hundreds of thousands of locations nationwide to pay for care whenever you need and want it. If you are interested in applying for a CareCredit credit card or would like to find a provider in your area who accepts CareCredit, visit us at carecredit.com. And if you found this information valuable, please leave us a 5-star review on the App Store and a thumbs up and share it with a friend. I'm Amy Freena with CareCredit, and I will see you soon.